could give a lot of advice, but first you need to be happy. So happiness is something you cultivate and you decide to have or not have. Sometimes, of course, you're not lucky, but you know, happiness is the best way of struggling against stress. Stress is giving a lot of oxidation, a lot of unhappiness, and a lot of illness. Everybody needs to look good, you know, and be more beautiful. I mean, it's not only a way of being, feeling better with yourself, it's also a way of, as you were saying, you have this problem with aging of your face, for example, or maybe your neck is a little bit too fat, so you're losing a little bit of definition of your neck and jaw. So you want to improve something in your face, first to feel better with yourself, to feel more beautiful, and to look more relaxed. You know, it's so when you do perfectly aesthetic surgery, it's purely enhancement. It's good aesthetic surgery should always be very natural. When you have a beautiful Arabic woman, you have to adapt. She needs to keep a sort of Arabic nose. If you do a little American nose to a woman, Arabic woman with a strong nose and with high profile and definition, you need to adapt. Your nose needs to keep something from your background. So perfection is always depending on your culture, background, and everything. I've been giving the breast to all the children, especially for a long period. Automatically the breast is sagging, and if the breast is sagging too much, I will have to do more than filling the breast. It's not only putting an implant in the breast. It will be probably, if I have enough volume left, I will have to do a breast lifting. So it means that I will have to remodulate, to resculpturate the skin and the glandula. So it means that I will have some scar on the breast, most of the time around the areola, which we call commonly the nipple, and also some vertical scar. And most of the scars are becoming almost invisible after 2 to 3 years, but you have to wait. I mean, the scars are not invisible at the beginning, and it's true that in certain patients they keep a little bit of hyperpigmentation on their scar. So when I can put implants, I always hide the scar so we don't see the scar. Or when I can put some fat in the breast, because we can harvest the fat from the legs, for example, or the buttocks, and put some fat in the breast and give more useful and freshness to the breast, so the woman is happy. And it's good also for the couple. So all this surgery requires no scar. But of course, if I do a breast lifting, a real breast lifting, we will have some scar on the breast. Breast augmentation with implants, the scars are not visible. Breast augmentation with fat, the scars are not visible. They are very, very little. Breast lifting or breast reduction, the scars are visible for 2 years. If you have a person who is suffering of hyper-obesity, very severe obesity, maybe this person will need what we call bariatric surgery. Bariatric, which means that we do something on the stomach or we do some deviation, so not all the food will be digested. So we need to help the person this way, so we reduce the volume of the stomach or we put a gastric lap band on the stomach. So like this, you know, the person is obliged to eat less. And eating less, the person is losing weight. So when we have very severe obesity, I recommend to keep this approach. If the person doesn't want to get this type of treatment, I can start with one very good liposuction and then another one liposuction, and then in the meantime we go on with diet, very proper diet. It means that it's not fantasy. We need to have, or whether the patient is well educated and she or he knows perfectly what is authorized to eat or what he should avoid. I'm not saying it's totally prohibited, but what he should avoid to eat. In most of the cases, we need a nutritionist. We need somebody to help the patient to educate the way he's eating or she's eating. So we do, in the meantime, we do a big liposuction and then nutrition and other liposuction again, and then eventually body lifting. But when I say big liposuction, there's always a limit. It shouldn't overpass 10% of the body weight and especially of the body surface. That's why we don't do mega liposuction. So it's normally you don't lipoaspirate or liposuct more than 10% of the body surface. It's one of the safest in condition that it's well done and with a patient who understands what we do and also a patient who is responsible. So if we do a very reasonable, even a big liposuction, but not overpassing the 10% of the body surface, we have almost no risk. And it's the procedures which is the most common in all the works, doctor. It gives good result, but it needs to be well done, well planified, and also with a patient who understands that it helps to lose weight. But if you go on with excessive diet, you go nowhere. So it's no use to go for liposuction if you're not able to refrain a little bit on sweet and fat and you saw what we call carbohydrate and cholesterol. You need to understand that it will really help you if you also help yourself. Common when you do a big liposuction on a fat woman who is diabetes and have high level of cholesterol, you will because when you do liposuction, you remove some fat of the body and sometimes a big quantity of fat. You will always improve a biological status considering diabetes and cholesterol. It means that after the liposuction, she or he has less cholesterol and less sugar in blood. When it comes to surgery, definitely it needs to be a plastic surgeon performing surgery. It means that plastic surgery. Plastic surgeon because they are well qualified and trained in plastic, reconstructive and aesthetic surgery. So it's very important that it's not a dermatologist or it's not a general practitioner who is doing aesthetic. You can do the work this way. It's like being, you know, an orthopedic doctor. Well, it looks easy to suck or vacuum some fat, but if you have a bone fractures and you need to go to a orthopedic surgeon, you're not going to go to your general practitioner. That's the same for plastic surgery. You need competence and qualification.